Hello everyone, I hope I'm audible and visible. Let me check in my phone. Hello everyone, I hope. Yeah, it is audible, uh, visible as well. So let me see how many of you are there for this session, because this session is going to involve nothing but the ugly truth about what is the reality if you want to choose MDS in a branch called Periodontics. Okay. I'll myself, Dr. Amit Lall, co-founder of Dr. Lall's BDS to MDS app, if somebody is new to our channel. Please type some message so that I know that you are able to see me and you are able to listen to me. This session is going to be like first in the series of mm, okay, we'll do for all the specialities. And let me see, there were a few queries in our group as well. I had asked our last year students to post queries. People molded in a specific branch. Okay, 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 great. Yeah, good evening, Dr. Srishti Pathak. Only one person at this time on this Sunday. So today is 1st of June and we are doing a session on Perio. There are many random thoughts when it comes to like how to select a branch. I have already been posted like around 10 months back few videos how to select specialty, how to select a government college, how to select a private college. Then last year what we did was we invited many experts also and some faculties and some senior fellows also like Dr. Nikhil Srivastav sir for Periodontics, telling you the scope, what is the scope of the branch. Okay. And oh, this connection is gone. Just to give me a second. Yeah, just give me a second. My iPad has got disconnected. Yeah, now it is done. Now it is done. So we invited people, specialists who are doing really good in their field. We invited for Endo, Dr. Varun Pruthi, Dr. Pedo, Dr. Nikhil Srivastav sir, OS, Dr. Rohit Punga, Ortho, Dr. Aman Sachdev. Okay. And we'll keep on accelerating those sessions as well in coming days. But problem is not still solved because the kind of queries, the kind of hurdles, what I feel rankers like you all who have really worked very hard to get a government MDS rank in 2025. Now you are at a crossroads situation whether to choose this branch or not to choose. because the kind of thoughts I have been listening in last 10-15 days post result which came on 15th of May is very weird. And it's not just you, actually, it's like weird in terms of every year, every batch, every person is hell confused which branch to go for, which not to go for. There are certain things which you have to keep in mind when it comes to branch selection is like, number one, we are not talking about Perio as of now. Okay, we'll definitely discuss in detail Perio because that's the agenda for today. But in general, when you are selecting a branch, okay, many students have been telling me that we have interest in this branch. Like they can say they like OS, they like Prosto, they like Endo. Few girls said they like kids and pedo. Okay, I won't name the students and the rankers. Yeah, good evening, Dr. Arfa. But so on. Second is they feel it is easy to settle down after certain branches. Like they feel endo and pedo prosto will make them settle fast. Okay, easy to settle down. Third parameter, this is what the students, or you are not no longer student, future MDS doc thoughts. What I have been listening on phone and messages and other things. Okay. Then money aspect, like this branch will give me money, this branch will not give me money. They want to stay in India or they want to move abroad. So that is something like they are putting thought on, right? Some say there are job, which branches are job oriented. And the commonest answer is like they think non-clinical branches are job oriented. Just tell me whether I am right or wrong when I am noting down these points for you. These are your thoughts which have been given to me in last 10-15 days. Okay. Anyone like, are these thoughts genuinely like coming from students? You feel these are rattling your brain or it is something like you haven't heard of these things? Please reply in the chat section, or is it my chat which is, yeah. So these are the thoughts of you guys, you rankers, okay? But nobody, no one is talking about, no one is talking about what's your future in the specialty or branch. What will you learn in next 3 years versus what you should learn to face the world after MDS. Nobody is talking on these lines. So I'll simplify. Nobody is talking about how you look forward to when you pass out of MDS after 3 years. What will you do after 3 years? Nobody is talking about. Okay. One safe bet is you choose a college which has a bond 1 year, 2 year bond. Yes, Maharashtra state has bond, UP state has bond, some Gujarat has got bond, other states. Okay, you choose such a college that you have to work after that. That is a very safe bet. So that you get 1 or 2 years more to think about these questions. But what problem is going to come after 3 years, is going to come after four also, is going to come after 5 years also from today. So you cannot run away from this question. Okay. Basically, how and what will you do post MDS to make money? That lot of work, be successful, that name, fame also. If I ask you this question, what is your answer? If I ask you this question, oh, this is a problem. What do you want to be when you grow up? Generally, I get this answer. I want to be a prosthodontist. I want to be oral maxillofacial surgeon, orthodontist, pedodontist, endodontist. Generally, I get these answers. But the answer should be this. Bottom line. If you are already very rich, you want to be famous. If you are already very famous, still you want to achieve more heights and become more successful, accepted in the society. That's what everybody aims for. We are working to rise in the pyramid of Maslow's hierarchy of needs. Nobody wants to remain at the bottom of the pyramid. I hope you remember that. Okay, just give me a second. This is a little problematic. I'm using it for the first time now after a long time. I forgot to not to press escape button. Just give me a second. Yeah. So the answer is not here. Even when I was at your stage, my answer used to be this. But this is not worth it. Okay. We want to be successful. We want to be rich. We want to be famous. Bottom line of anything. Okay. So coming to our topic for today, for which you have logged in and signed in on YouTube and watching this session is Periodontics. If somebody wants to, why I chose this is because my opinion on becoming successful after Perio is very different from what you might have heard of, or you might have seen, or you might have, you can say, come across. I know it is going to not make many periodontists happy who are listening, with all due respect to you all successful periodontists in the country and abroad. The opinion is very much based on my last 20 years of existence in this dentistry field after my BDS from GDC Mumbai. And that experience is like meeting n number of people, Perio, and discussing with a lot of stalwarts in the Perio what I'm going to share today. Okay. Our topic for today and every such session will be like today we are discussing a specialty called periodontics. Whether you should take or you should not take, it is your decision. This session will make you understand how you can become rich, famous, successful after Perio MDS. So does this topic make sense to you today? Are you like interested in listening to this answer to this question, or you are not interested in listening to answer of this question? Whether you take perio or not is not my concern. I am not a periodontist, so I am not promoting this branch. I'm just trying to give you the ugly truth which most of the people in the profession are reluctant to say. I'm going to tell you that part which will really make you help you grow after you do your MDS in Perio. So are you interested or are you not interested? Just type interested, not interested. Please type interested or not interested. No reply. No reply means not interested. Chalo. Even one person listening and even one person interested gives me a boost to continue with this. Yeah, great. Okay. Thing is, yes, thanks Dr. Ritik, Dr. Santli Singh, Dr. Kiran. Firstly, let me ask you, like, if somebody is going to do MDS in Perio, I've been listening to many people, discussing with many periodontists, and going through the curriculum of MDS in Perio, and watching videos related to scope of Perio. You can type in YouTube. Okay, great, Dr. Hansika, not interested. Okay, people have been talking about scope of Perio, that what Perio person, Perio student will do in 3 years of MDS. We always talk about, we take up issues like gingivitis, treat diagnosing and treatment, periodontitis. Gingivitis and periodontitis are the, you can say, the most widely spread disorders across the globe. Then they talk about in detail about preserving the foundation of the tooth. That's what a periodontist is, dealing with the foundation of the tooth. Then they talk about procedures like surgical procedures, gingivectomy, crown lengthening procedures, resective surgeries, grafting, okay, mucogingival surgeries, frenectomies, multiple surgeries they will describe and define that you will be doing these things in your 3 years of perio, and ultimately you will be doing a lot of perio to save the tooth. To save the tooth. I hope everybody is well versed with this part of perio. Then, as per DCI curriculum, you are also allowed to do a lot of implants. Okay, perio person is doing nowadays perio aesthetics works also. Lasers are also now incorporated in perio curriculum. So you have a lot of things which you are going to do in perio in MDS, during MDS. But when you walk out, when MDS is over, when MDS is over and say you are an MDS, you are writing Dr. ABC is now MDS periodontist. Suppose this Dr. ABC has got 2-3 options of settlement after MDS periodontist. One, he or she opens up, suppose he is he. It will make my task simpler. He opens up a clinic after MDS where he works as consultant in say 2, 3, 4, 5 clinics. He has joined some corporate chain as periodontist. Another option is chalo he joined some college as senior lecturer, or some colleges write associate professor, government colleges like. Okay, if you get a job something like SRship, okay, or senior lecturer in a private college. These are the broad spectrum of passing out and getting placed. But that's also depends on multiple factors. You know that we will discuss that sometime in a different video. But today let us focus on Perio. In if he is working as a consultant, means he is going to 2, 3, 4, 5 clinics and he is being called only for perio surgeries majorly. Plus maybe a little bit of implants and plus maybe lasers, but these two are very subjective. To become an implant consultant and laser consultant immediately after MDS, you need to invest first in implantology. You need to invest in lasers. You should have your own equipments, armamentarium. Then only somebody will call you. And lasers are not something which you can carry in a small bag and roam around as consultant. So generally laser part is out as a consultant. Nobody calls, being like practicing for last almost 20 years now. I tell you, nobody calls in a clinic for lasers. Yes, implants, people do call. I also go to certain clinics for implants, but that person has to have implant system. Mostly he or she should have physio dispenser also, plus lot of things to carry around. Okay, so only perio work के लिए you are going as a consultant, right? Same is the corporate chain periodontist. He will be designated mainly perio surgeries, implants, and lasers. Now this is important because generally corporate chain like Clove and Subcom Dentist and all that, they already have implant system, they already have lasers, so you don't have to invest there. But here you are on a payroll plus some commission. Payroll plus some commission. College lecturership, SRship. SRship is good if you clear say certain exams like AIMS SRship or any PGI SRship or any big institute, you are on a very good track. But that is not everybody's cup of tea. There are hardly 1, 2 or 3 seats every year coming up. College, again, many colleges will offer you like if there is a vacancy, you can join as a senior lecturer, but that is something you want to be going in a different path altogether. We will discuss it in the end. Here comes the last part. Suppose a periodontist, Dr. ABC, he opens up a clinic. What do you think will be the source of income in his own clinic? You answer. I'll ask you questions. You answer this. Let me see how much basic knowledge of clinic you have. Can a periodontist survive only by doing perio surgeries in his clinic? Number one, can a periodontist survive by only knowing implants in his clinic? Can a periodontist survive by only knowing lasers in his clinic? Will every walking patient in his clinic require and will agree for perio surgery? Will every patient walking in clinic requires and agrees for implant or lasers? Please answer yes or no. No. No, and it is big questionable. Yes, Dr. Ritik, you are right. Answer is no. No for all the things. So then, my dear friend, what is the question? How Dr. ABC will earn money after MDS? Same is the situation here. If you are even, say you come to my clinic, I am a periodontist, okay, I know this, I am from very good institution, say you are from KGMC or you are from PGI Rohtak or AIMS or whatever, and I will definitely be interested in calling you as a consultant. Will I call you every day? You go to 10 clinics, they will say, agree that they will call you when the patient comes, but they will call you as and when the patient agrees for perio treatment. So this is also becomes a lot of questionable. When will you get a consultation to work upon? You will go mad. Okay. You will actually go mad sitting idle at home and waiting for a call that yes, please come for this consultation. It takes time to build a consultation network. I'm not saying you will not get any work. You will get a lot of work over a period of time, but that is like 2, 3, 4, 5 years of existence as a periodontist and being available to all those clinics every day on call. Corporate dental is a good option for initial days because it gives you a payroll plus commission. It is a good opportunity. It's always, if you get absorbed in a corporate chain, never lose that job. You will always feel they underpay you. Yes, they are underpaying you. Like KGMC, Maulana Azad and all, they will give you stipend of 1 lakh per month. And these corporate chains will start from 40, 45,000, maybe 50,000 per month. It is underpayment. I agree. But they at least give you something to start polishing, honing your skills, which you have gained in 3 years of MDS. You have to show to the world, you have to practice, you have to learn the art of private sector after coming out from the government college. This you will realize in 3 years that working in a government setup and working in a private setup is a way different entity. So anybody who is after 3 years you get a job, definitely take it until unless you have a plan for your own clinic. Okay. So question still remains how ABC, Dr. ABC will earn money after MDS, especially when you are planning your own clinic or you want to work as a consultant. Any idea? Any thought on this? Problem lies where? Problem lies we treat branches of dentistry. Now many stalwarts in dentistry will feel offended, but I am talking in interest of you guys, my students who have cracked MDS and who are entering MDS. Okay, we treat branches of dentistry, or you can say specialities. Chalo, especially the clinical ones, equivalent to branches of medical world. Equivalent. Problem is that, in simpler words, medical world has like MS of Thal, MS ENT, MS orthopedics, MD dermat, MD or MS, both you have gynae, MD medicine, and so on. You know the branches, need not to discuss. Radiology, radio diagnosis. The problem is these branches, this is not, people are not differentiating. People are very innocent. Your patients, future patients are very innocent. Okay. We divided the line. It's all in our head. That is why people are able to draw the line. Okay. MS of Thal has got no link. What is a dermat going to do? Gynae going to do? And so on. Same is same is same is the situation here, because there is a thick line between the two branches of medical world, thick line. But in dentistry, MDS like endo, pedo, perio, prosto, there is not a very thick line, there is a thin line. We cannot say endo person is not at all linked to these specialties. Perio person is not at all linked to these specialties. Pedo person will not do adult patient in his clinic. Firstly, come out of this thought. Okay. First you come out, then only others will come out, and then only your patients will come out. Don't promote after MDS as a specialist of only perio. To me, this was a conversation I was having with one HOD of Perio of a very reputed college, I won't name. And he was shocked when he got, like, we were discussing something. And when I shared my thoughts, he was really shocked. And he invited me to his Perio club on this thought. Then I had this discussion with one of my teachers. I respect him a lot, Dr. Rajiv sir. And he was like, this is what people, your students should know before joining a college. And that is his like inspiration. I am talking to you guys today. Take Perio as a super specialty branch. This is the reason I am starting from Perio today, because this is the thought process nobody is ever going to speak out to you. Nobody is actually daring to talk like this. I really wonder why. Forget about what people are talking about Perio and listen to this with an open mind for next 5 to 10 minutes. Then you share your thoughts. I'll answer your queries. Treat Perio. Treat Perio as a super specialty. Our specialty is teeth. That is how you did your BDS. BDS was already a specialty. BDS was differentiated from MBS and MBBS because it was a special segment of medical world. Okay, it was already a specialty. This is where the first loophole comes into picture. Then you did like this specialty involved teeth, and this specialty involved what all treatment? Extractions, RCT, restorations, prostho, that is dentures, RPD, FPD. To some extent cosmetics or aesthetics, to some extent little bit of perio, maybe non-surgical perio, pedo patients, OMR, basic aspect. Then it also included like nowadays you can even learn implants after BDS if you want to. You're already doing the theory part of it in your curriculum, right? Forget about OP, forget about other things. Itna to every BDS is already doing. If you add, if you retain this knowledge, plus add Perio to it, you become a super specialist in teeth because you know Perio which other people are not knowing. That makes a Perio person different than rest of the clinics in his town. जितने भी आसपास clinics हैं, those guys are least interested in doing Perio. But if you are a Perio, plus you know these things, you are going to be God in your area. God, what your generation says. Our generation used to call God. God. God of all things, all times, whatever, like whatever you call. I don't know the full form of God. It means what? If you are done with MDS Perio, you start your clinic and you are very well versed with general dentistry. That includes extractions, RCT, restorations, IOPAs, OPG, basic diagnosis, little bit of crown preps. Forget about dentures. Okay, convenience anything you are not very sure of. Crown preparation, that is single tooth crown. Okay, and you have little sense of aesthetics, like composite or ceramics. Plus, now you are a Perio expert because you have done MDS in Perio. You can't imagine the growth you will see in your own work, knowledge, confidence, expertise, consultations, whatever. You can handle the world with lot of confidence and pride. You will not be a handicap like what many BDS graduates think they will be if they take Perio as a specialty. Because Perio is not a specialty. Perio is a super specialty. Why it is? Because it is forming the foundation of the tooth. Foundation. A Perio is a person who will make better diagnosis than endo guy, prosto guy when it comes to saving a tooth. You know, a tooth can have what problems? A patient can walk in with a problem of enamel, that is cavity. Patient can come enamel plus dentine, again cavity. If you know how to do good composite restorations, GIC restorations and other restorations, you are going to be the best dentist for the patient. Then patient can come enamel dentine plus pulp. You should know how to do RCT. Good RCT. Then most of the RCT cases have already loss of tooth structure is there. This is I am talking all possibilities how you save a tooth. Loss of tooth structure. Okay. Loss of tooth structure means post and core. You should be aware of. Plus most of the RCT cases like class 2 situations will have pockets. Then here comes the picture because pockets are not well treated by general dentist. That is that a BDS guy will not be very interested in treating pockets, or he or she is not aware of what is the problem of overhanging margin, what is the problem with by giving bad crowns, what is the biologic width, what is the gingiva, what is width of gingiva, attached gingiva, nothing is interested. But you as a periodontist will treat this also. Most of the times when we are doing RCT and we are doing crown, we are doing CLP also, crown lengthening procedure. Here your perio expertise will come into picture, which nobody else in that area is actually doing it. So if you talk about saving a tooth, you are a person who will immediately plan better, like you will do a better treatment planning than any BDS endo prosto guy, because you know what is happening at the perio level also, provided you are well versed with the nuances of general dentistry. Provided, this is a catch. Okay, treatment planning, then execution of the treatment. No matter what, you take any, start going to any clinic, any patient of the clinic either needs perio before other treatments or needs perio after other treatment. Do you agree with this or not? How many of you agree with this? Any and every patient walking in your clinic actually needs perio either before the treatment or after the treatment. But yes, we don't do the treatment because most of the time we hate perio, we don't like the branch, or we don't know whether patient actually needed it or never needed it. You know, one very strange fact which I observed in my own self and practice, and I used to laugh at others when I was growing in these last 20 years of my clinical experience. We don't promote that treatment in our clinic which we ourselves are not skilled at. Like I tell you, when I started my clinic, I was not aware of implants. 2006 November, I started my clinic. Okay. I had zero idea. I didn't even know I of implant. 1st January to like 5th November 2006, I opened my clinic. 1st January 2007, that is hardly 2 months, I got my first patient of implant asking me कि मेरा ये central incisor, it got injury. He was my friend. We used to play cricket long back and he lost his central incisor in some cricket match. Okay. So he wanted an implant. He had that Maryland bridge hanging and he used to make fun of that. Okay, young guy, like same my age only that time almost. I had no clue what is the cost of implant, how the procedure goes by, what is the timeline, what are the charges, nothing I knew. What I did was I called one oral surgeon, please come and do consultation for one patient for implant, tell him. And when he was doing consultation, I was like, it is not making sense to me. And I was afraid whether this guy is going to do justice to my patient or not. That day I decided I will start learning implant because till then I am not giving my patients option of implant because I don't know implant. So anytime I used to see a missing tooth or missing teeth, I used to cut and put a bridge on it because I was very good in crown cutting. Till date, I by God's grace, I am very good in crown preps. I know that. Okay. But after learning implants, 1 year course from Germany, I realized it's not worth it. Now my treatment plan changes. Now when I look at a dentulous tooth, a dentulous span, I discuss all the possibilities which are best for the patient and then let the patient choose. Same was, I remember, post-endodontically, I was not aware of when and why to do post-encore. I did 2007, there was IACD conference, I remember, in Jaipur. I went there. I had attended n number of conferences to gain knowledge and experience in all the maximum possible treatment options of general dentistry to make myself confident practitioner and a successful one. That is the reason I'm able to talk to you in front of you guys today. So this is actually a true statement. Today, when I am doing, like, I am not doing RCT nowadays, but when we are doing RCT, if the patient needs crown lengthening procedure, this is my diagnosis because I am very good at putting a crown. So I know whether my crown will require ferrule, will get ferrule or will not get ferrule. So I will do crown lengthening procedure. That is a perio procedure. Nobody taught me because I am not a periodontist. I attended workshops and learned CLP. Okay, it just take 5 minutes. I even recorded a video long back. It just take less than 2 minutes to do one CLP after injecting. Okay, without bone cutting. So I am doing, if my patient requires CLP, we do CLP without charging the patient. Just we tell the patient that yes, it is required and it will enhance the longevity of the crown which I am going to place after that RCT. That is the beauty of knowing perio. That is the beauty of enhancing your knowledge. If you treat you like during perio MDS or after perio MDS, you gain back your knowledge, expertise in general dentistry. Then you go to any clinic, you go to any corporate chain, you go open your own clinic, you will mint money like anything. Nobody will stop your growth after that. And all those successful periodontists who say that we do only perio in our clinics, with all due respect, either they don't tell the truth or they are not working at all. That's what I believe. It's not possible. But yes, all those periodontists who are very good at general dentistry, very good, because they never thought they are only periodontist. Okay, that is some, you can say, in Desi Bhasha, you have to keep your ego aside of being MDS in perio. It's not about that actually. But if you know general dentistry, then sky is the limit of growth after perio. You can be master of aesthetics by learning composite ceramics and perio aesthetics. You can be master in implants. But in implants, you will have to learn the prosto part of implant. You have to gain training. Okay? Because perio will inhibit, like you can say, stop you from learning that prosto part. You can go for higher surgeries. Learn higher surgeries in implants, like zygoma implants, maybe nerve repositioning, maybe sinus lifts and all. Nobody is stopping you. You know what problem arises is when we think that MDS is dead end of education. Then you are already in the segment. then you will end up making no money, no fame, no success. So if you are done with Perio, invest in education. Which education? Education in general dentistry, education in aesthetics, education in implants. If your MDS is teaching you implants, how to place implants, how to save implants, how to save the soft tissue around implant, but in MDS college, whatever college you go, see every college has got plus and minus aspects. If you go, if your college is not teaching you the prosto part, you can always save money during your MDS, all those who are entering into government. That's what I always say, 3-4-5 lakh रुपए बचा के रखना after MDS. That will help you invest in all these things, plus your own clinic as well later on. Invest in education, invest in learning prosto part of implants. You go and see there are mentors across the country who are conducting workshops only prosto in implants. Dr. Dhruv is also conducting. My batchmate and very popular implant surgeon Dr. Komal Majumdar is also conducting. They have a special course called implant prosto or prosto implant, something like that. Okay. And in that course, who all are attending those courses? Oral maxillofacial surgeons are attending. Even some prosthodontists are attending. Perio people are attending. Endo guys are attending. Because they don't want to get lost. They don't want their implants to fail. That is one aspect you have to enter your MDS with. You cannot enter your MDS with the thought that after MDS, there is nothing left you have to learn. The day you enter the thought like this, you get a thought, your downfall will start from that day. I'm sorry, but this is a fact. If you keep on upgrading your knowledge in all the things which are going to cause hurdle or are causing hurdle or making you stop from enhancing your spectrum of treatment, it means you are stopping your growth. Initial days, save money, invest in education. Say you today you learned implant prosto. So tomorrow whatever implants you are doing, we will not call any prosthodontist. You will do it on your own. Already you are doing very good implants because you are a periodontist. You are doing very good perioaesthetics, but you had no knowledge about ceramics. You had no knowledge about composite. So do some course ना 2-3 days के courses होते हैं. Hardly 30, 40, 50,000 में you will learn lot of things which you have never ever learned before. Whatever you are investing, say you are investing 50,000 in aesthetics, you do one full mouth case of aesthetic that will give you 2 to 3 lakhs. Instant money, instant money. You spend implants का say 25 to 30,000 on learning implant prosto. You do 2 good implant prosto and your cost is recovered. You remember glycolysis we discussed in biochemistry? Everything has an investment involved. Either in terms of what you did in coaching was an investment which has given you fruit today. Okay, but that investment was not only about money, it was investment of your hard work, your studies, your intellect, your journey towards your goal. Without investment, you cannot expect return in life. This is all we have also grown in. I have also grown in life. You know, I used to save money, do some course. Whatever course I am doing, today also I am like almost every 2-3 weeks I am doing some online workshop or something. Some or the other, I can't tell you all the details, but I am attending workshops. If I am attending a workshop, say I have spent around 10,000 today. First thing I'll do it, I'll try to adapt that knowledge and try to add it in my skill, and I'll try to recover that money. And trust me, you get this money back very fast. Maybe first patient, 2 patients you still do almost at no profit, but third one is going to add a lot of profit because you have gained confidence now. So all those who think Perio is a dead branch is because your mindset is dead, my dear friend. Branch is never dead. Branch is will keep on growing. especially after implants and aesthetics adding up. Perio though is booming like anything, but people are not booming because they think perio person is meant only to do gingivectomy, only to do crown lengthening, only to do mucogingival surgery. Sorry. The day you are ready for the world in perio, you are going to rule the world with perio. You know, the topmost people in implantology are periodontists across the globe. Topmost people, like the people who are actually dictating the algorithms of implant, are like Dr. Morris Salama, and they are the gods in implant world. They are periodontists because they develop like, and this is what I am talking about immediately after passing out. Maybe after 5 years or 10 years down the line, being a periodontist, now after doing a lot of work, you will choose. Like today, I told you I am not doing RCT in my clinic. Very rare I am doing it. Some patient irritates like कि आप ही से कराना है, आप ही से कराना है, 20 साल पुराना पेशेंट है, 15 साल पुराना पेशेंट है. Then I am doing it, but I am not enjoying it doing it. Yes, I love doing crown press till late, but this is what you grow. You upgrade yourself. Nobody is asking you to do rest of your life general dentistry. But if you run away from general dentistry, if you run away from the basic part, then perio will become a dead end for you. Perio is a no branch for you. If you are not ready to take perio as a super specialty, this is the thought which I don't know why periodontists are not giving to people, students. No periodontists, I have listened to at least 10 of them on YouTube. Nobody is ready to accept and say that they have gone the path of general dentistry and then evolved as a periodontist. You call yourself Perio, you put your visiting card, business card as Perio, you put any number of videos related to Perio, but in your actual world of practice, you have to do general dentistry to rise in your own profession. That is what I wanted to share about how to be very successful after Perio. Now you can ask your questions and then we end this session. Like this, we will discuss anything you want to ask or something. I have, I think, covered the questions which were asked in the WhatsApp groups. We will discuss each branch. Okay, what extra you need to add to that branch to be very successful. Perio definitely needs to add general dentistry aspect. If you add this, you are on next level track. Dr. Amarjeet, this is not a place. I can't comment on this, but I doubt SC category rank 105. See, Dr. Amarjeet and everybody, if you have a category rank of say 2 digit or 3 digit, see past year trends, how many seats are there in your category? If you have say rank 77 and there are hardly 25 seats in your category, you also know this is not going to happen. I hope this answers your query. Dr. Soilo worry, yes. What is wrong with that? What do you think? Like people will laugh at her that she is doing general practitioner. She is doing general practice. Will people laugh? I'm sorry. If she is doing good in her own life, nobody is going to laugh. जो हंस भी रहा है, he or she is an idiot. Okay, don't worry about what people will think. Those people are not going to give you bread and butter in your life or make you rich in life. My ASC rank is 105. No, Dr. Amarjeet, I don't think so. 105. Okay, I hope you got some insight and thought process on this. Let me see what are your inputs. Otherwise, let's end this session. I'll just wait for 1 more minute. If you have any query or something, you can definitely ask. Otherwise, let's say good night for tonight. And chalo, hope this session will bring you some insight, okay, and help you choose Perio or not to choose Perio at least. Thank you. Good night. Take care.